Greeting everyone. I'm Dr. Deependra from Conceptual Orthopedics, and I welcome you all in today's connect session with Vivek sir. So after I think long time, sir is back with surgical series. Another very important session on proximal humerus tumor, and today sir is going to discuss his clinical anatomy approaches and surgical video if possible. So I think this talk is going to be very useful to all of you, not from your MSK Anko point of view, but also you are going to be helpful because you are going to see so many proximal humerus fractures. So this talk is going to give you insight how to fix, how to approach this proximal humerus fracture as well. So without any more delay, I welcome you sir on the board and I request you to start the presentation. Also over to you, Dr. Vivek.
Yeah, thank you. Thank you, Dipend. So yes, after a long time and you know, guys, so I can see a few old names and many new names also. So I can see who all are there. So apart from our old team, I can see Neha, Praveen, Tarun, and so many. Daksh, Abhishek. Okay, good. So few people are interested as usual in ortho-onco. I'm sure trauma and other things, which is more fascinating in the early stages of learning, especially in the residency, where the things that you see every day, you like to learn it and you want to know more about it. But sometimes things which you don't see commonly, you don't develop that interest unless you start seeing those cases. And this is how I feel orthopedic resident finally makes up his mind what he wants to do in his life. So my screen is visible, friends. Depends.
Yes, sir, it's visible and you are clear.
Okay, great. So again, before I start, guys, let me tell you that we'll keep this interactive, and I will prefer that you guys continue talking. You can write in the chat box also. Where is the chat box? Let me see. So that yeah, right. So our chat box is also active so that I can keep seeing what you all are typing. If you have any queries, I prefer to keep it interactive. Now, this topic. Now, this is a surgical series I'm starting. So, what are we going to learn? Like I said, tumors is in itself a rare topic, but I'm going to cover it in a very, what do you say, delicious way. You will enjoy this because don't just think of it as a tumor. What we learn are very basic points, and I always emphasize on practical aspects of anatomy. Once you cover up your, clear up your exams after MBBS, and thankfully you all have entered into orthopedics. So the first thing is, after entering into orthopedics is you realize, oh my God, first year anatomy, we forgot all that. What it was, we used to dissect. So that is something I feel is a caveat that we should keep uh, revising the anatomy. And for an orthopedic surgeon, anatomy is very, very important. And in the subspecialty, when you go in like oncology, then it becomes even much, much more important because the basic topics that is taught the way the principles are taught. I'll share some very interesting scenarios with you. Hope you have some time. You won't feel bored when I talk things which is outside your curriculum. So when I moved from ortho, so I practiced orthopedics for 7 years. I was a consultant trauma and joint replacement. When I moved from ortho to ortho-oncology, I didn't know much about I mean, it took me some time to find out what was my topic of interest. So, and I realized ortho-oncology is something I wanted to do. One of the most common reason was because it was very fascinating to see big surgeries, big implants, exposure all around the bone. Now, what is this exposure around the bone? What I mean. So the principles that we are taught about how to expose a bone. Can anybody? You can write who all are from first year and who are from second and third year and who are post MS. So you can write so that I'll know who all are from which year. Guys, please just write if you are on first year, write 1, second year 2, third year 3, and post MS, you write post MS. Yes, Neha, okay, Tarun is post MS. Good. So two guys are, don't worry, if you are in first or second or third or post, I'm not going to ask you specifically, but I just want to know what should be the level of my teaching. Daksh is in second, Yuva is third. Okay, good. Good. Dishan is in third. Okay, so we have reasonably experienced people. Just now I was taking a lecture somewhere. I was invited to speak on recent advances in bone tumors it was in Muzaffarnagar, near it's in UP, near Delhi. So I met a first year resident. He had come out of interest. He was doing DNB. And he told me that he's also enrolled in conceptual orthopedics and he's a member. But he said, for me, currently, it is not very useful. So I said, why? So he said, things are high funda, all these things. So I said, yeah, that is true. But it is a spectrum. We start from very basics and then we move up to advanced. So you need to check out what things are there in the index, what you want to learn. So it's a very good reference guide. Rather than just reading the book and understanding things, you can always refer. And it's very easy because suppose if you see today a case in your OPD where there is a proximal humerus fracture, so you can directly go to the trauma section and see proximal humerus fracture, the classification. Our uh, our friend is taking very good in trauma. The video series are very good. I think in that perspective, when it comes to oncology, there is no book, I mean, for the post-graduation level, which gives you a good perspective about ortho-oncology. I mean, there are, you can take references, but things where you will be taught site-specific things. Like today, the topic is proximal humerus tumors. You will never get any material related to that like that. You may get general perspective about oncology, general principles, what is extended curettage, benign tumors, malignant, but specifically like proximal humerus and all is not taught. So these type of lectures or being a member of this conceptual gives you a leverage that you can go deep dive in what is your uh, topic of interest. It's not just about superficial touching things. If you want to know more, you can keep diving on the lectures which are there in the bank. So let us now come back to where we started. So guys, you tell me what are the principles of internal fixation? How do you approach a bone? What are the principles that you follow? If you see a supposed trauma of proximal humerus, let's say 2-part or 3-part fracture of proximal humerus, if you have to do open surgery. So which approach will you take routinely? You can write in the chat box. Now, this is not just a first year question. This is second, third. People can tell this even posthumous. What is the approach for proximal humerus? Deltopectoral, Good. That is commonly, absolutely. So what new I'm going to tell you about it? So friends, what I'm going to tell you is really something new because in tumors, we never go through the conventional approach. And why do we choose deltopectoral? Because, the basic principle in orthopedics, the first thing is taught that you have to follow a certain plane. There are certain planes that you follow. And what is that principle called? Which planes do you follow? Tell me. Any idea? Muscle interval? Okay. Internervous plane, right? Internervous plane. So usually the plane is between two muscle group so that, and both these muscle groups should have different nerve supply. Like when you talk about